Good evening. I'm Vicki Meek, and I am actually just recently joined Nominee Johnson County on their board of directors. I'm thrilled to be here tonight, and I'm thrilled you're with us tonight. I think you're going to be find this is really beneficial, navigating what to do in a crisis, and it's all those times. How often we go, okay, what do I do? Where do I go? Who do I call? They're going to talk about a lot of those things tonight. I have a couple of housekeeping things for everyone. In regards to this is being recorded, so keep that in mind. So if you can probably mute yourself, and for some people, if you don't want your face on camera, then you would also put your camera off because it is being recorded, but that's up to you. But definitely mute unless you are talking. Um, a couple things that are a little different tonight. We're going to have an evaluation at the end of the program, and we'll put a link in the chat for that at the end, and we'll hopefully give you enough time, or please stay and just hit it. It'll just take you a couple of minutes, but that's to give us feedback about the presentation, and also an opportunity for you to tell us, hey, this would be really helpful if we had this or we offered that. So that evaluation will be coming. The other thing we're adding is a certificate of attendance. For some people, you may find that at work you need something like that to show some of these presentations you go to, or you just want to keep track for yourself. With that one, we're not going to put the link in, but we'll put a reminder at the end that if you go to our Gmail, which is, no, we'll have this in the chat so you don't have to write it down or remember it, but nominejuco@gmail is the email. If you email that and say, hey, I was at that presentation, probably, I think it's Kelly then will send you the certificate that you can fill out. And it's a fillable type of certificate that you can fill that you were there and what the presentation was. So I'm really excited that we're starting that tonight. And please give us feedback if that works or doesn't work for you. So I don't want to do a lot of talking because we have two presenters tonight, and they're dividing Kelly Jackson, who is our executive director, that many of you know. And if you don't know, you need to meet Kelly because she's pretty amazing what all she does for Nominee JUCO and beyond. So Kelly will be presenting first, and then we have Jen Melby, who is, let me find, she's a co-responder team leader at Johnson County Mental Health Center. She's been a co-responder for many years, but she's now a team leader. And prior to that, she worked at Osawatomie State Hospital, and along with other community hospitals, hospital settings in the metro area since 2012. So Jen, we're very happy to have you here with us tonight. So just as for intro, and again, we'll keep this as short as possible because I want you all to hear what Jen and Kelly have to present. So Nominee Johnson County, first of all, and this slide just tells you a little bit of what all that it does for the community. Nominee overall is really the leader for grassroots resources for individual, and obviously Johnson County is our local affiliate, but support it does for education, provides education, advocacy, which is really, I think, important and vital for all of us. Many, as this presentation, but also what's on the website. Please, probably the best thing you can do is go to our website and can tell you all sorts of things that we do. Because I know if you're like me, I do get the emails. I get many emails, and then you're going, oh, where was that? I'm trying to find it. But if you go to that website, it kind of in one place just really shows you what's going on and what we as Nominee Johnson County have to offer, as long as what's also offered at a national level. So then, if I can move this, sure, let me move it. There we go. That's just a reminder of what's going to happen next month in May. And Catherine Melton is also on our board of directors. She's going to be presenting the Joy of Movement May 7th, 7 to 8:30. And Catherine is the founder of and the lead consultant for integrated well-being. I think it's consulting. I'll have to look at consulting company. There we go. Get the right name. And so she'll be presenting next week, and I'm sure it'll be extremely beneficial, because more and more we're seeing the research about how important movement and exercise and what it does for our mental well-being, as well as our physical well-being. So I'm looking forward to that. And then I think, this is really important. Mark this on your calendar. For June 1st is our walk, our NAMI walk, and it's at Sarco Park Trails, which is in Lenexa, and it starts check-in is at 9, and the event starts at 10. But what we're doing right now is gathering people who volunteers. We welcome any volunteers. We have plenty of opportunity for volunteers in many areas of Nominee Johnson County, but the walk is going to be very important. The walk is important. It's really one of our major resources for funding for all the things that we provide. We provide this offering at no cost, those type of things. So the walk is really, really critical to our particular nominee organization. So that's on June 1st. I went in last night and I signed up to get my team going, which is a very small team right now. So if anybody wants to join me and my team, go ahead. My husband's there, but it was really easy to do. I was really pleasantly surprised. It was easy to navigate, pretty to set up your team, or you can do it in individual. You don't have to have a team. You can just join and walk as an individual. So I hope you can put that on your calendar. It really, really is important, and we appreciate all the people that participate with this. And then that, as I mentioned, the website, that nomineejuco.org, really, really helpful for you to have the resources in one place, so you can see what are they doing, because it's pretty incredible what this organization provides as in support, education, as an advocate. So I hope you will, and it's all Facebook, Instagram, LinkedIn. We're trying to get out there into the social world as much as possible. So I will stop talking unless anybody has questions, so that we can hear. We're going to hear from Kelly first, and then Jen. And also we will provide time at the end of the presentations for questions. But if you have something, you obviously you can ask a question in the chat, and I'm going to try to watch that for them. And then we will, at the end, provide you with enough time to complete the evaluation. And I think we're ready. Any questions?
Yes.
Everybody ready to go?
Any questions? All right. Sorry, I have small technical issues. It's like I'm trying to get there we go. Okay. Hi, everybody. I am thankful that you have decided to join us tonight. This webinar is going to be full of lots of information and details. And I think at some points it might feel like you are drinking through a fire hydrant. So I just want to let you know that every single bit of this presentation will be provided to you through our booklet called Navigating a Mental Health Crisis. It will be emailed to you along with the crisis plan that we will talk about at the very end. So do not fear about taking notes or about trying to capture every single piece of information, because all of this is going to be provided to you. I just want you to sit back and listen and really think through the people in your life that have gone through a crisis or have that potential, and gain some good skills on ways to get ahead of it and prepare for that time if it were to happen. So tonight we're going to use some terms interchangeably, like mental health condition, mental illness. These are going to refer to a variety of mental illnesses, but not limited to like the depressive disorders, anxiety disorders, bipolar, PTSD, or post-traumatic stress disorder. NAMI views mental health conditions or mental illnesses as physical conditions, often requiring medical treatment. Just like any condition with diabetes or high blood pressure, we see the brain as the same type of organ. Mental health conditions are physical illnesses that result when one of the many mechanisms of the brain is not adequately doing its job. So tonight we're going to talk about crisis episodes related to mental illness. These are very overwhelming. There's the initial shock, and then it's followed by just a flood of questions. Many of the times it's like, why him or her? Why me? What went wrong? Did I cause this to happen? What didn't we do right? There's a number of questions. Everyone can feel overwhelmed and confused and experience that anger, grief, or guilt. And it's important to remember that we all do the best that we can with the information and the resources that we have available to us. So if you've ever taken one of our family to family classes, oftentimes we say you don't know what you don't know. And so tonight, hopefully we're going to learn more, and we're going to gain some more skills and tools so that we're ready. So like any other health crisis, it's important to address mental health emergencies quickly and effectively. With mental health issues, sometimes these crises are difficult to predict, even when there are no warning signs. Crises can occur when treatment plans have been followed and mental health professionals are involved. But unfortunately, unpredictability is the nature of mental illness. So unlike health emergencies, people experiencing mental health crisis often don't receive instruction or materials on what to expect after the crisis. So also, it's possible that the first point of contact could be with law enforcement personnel instead of a medical personnel, since behavioral disturbances and substance use are frequently a part of the difficulties associated with mental illness. So many NAMI affiliates work very closely with our local law enforcement agencies to ensure that officers receive the training needed to deal with those with a mental health condition in an appropriate way. And I'm excited that Jen is on after me. After I present this, she's going to fill in a lot of gaps of what happens when the police are involved in a mental health emergency. But we want you to know this thing as we go into this presentation. You are not alone. You are not alone. That this is not your fault. You deserve help and support, and there is support available for you. So,
Kelly, I'm going to interrupt. Can you?
yes.
We're not seeing your slides. Can you upload them?
Let's see. Okay.
I didn't want to mess. I didn't, because you
Can you
started it, so I didn't
Yeah.
want to.
Can you see it
Sorry.
now? Are you able to see it now?
We can
Not
see
yet.
the set of slides, so maybe you're sharing a different screen.
Oh, let's see. Okay. Sorry. Give me a second. Thanks, guys. I apologize. Let's see.
I thought it was only me seeing those slides, and then I realized.
Okay, can you
Sharon
see that?
was in. Yep.
Yes, we can see the agenda. Yes.
Okay, yay. Okay, so this is all that we're going to cover tonight. Like I had mentioned before, it's going to be a lot. So don't feel like you need to take notes or anything, because there's just going to be a lot. You're going to be given everything in your email box by tomorrow. So, okay, is that working? You guys see this screen? Okay, good. So the prevalence of mental illness in the United States is quite significant. 1 out of 5, or about 43.8 million adults, experience mental illness in a given year. Among the 20 million adults who experience a substance use condition, about half of them have a co-occurring mental illness. 1 in 5 youth aged 13 to 18 experience a severe mental health condition at some point during their life. And 46% of homeless adults or those staying in shelters have a mental illness and or a substance use disorder. 20% of state prisoners have, and 21% of local jail prisoners have a recent history of mental health condition. 70% of youth in the juvenile system have at least one mental health condition. And 60% of all adults and almost 50% of teenagers with a mental health condition receive no services at all. 50% of the adults with mental illness reported experiencing symptoms around or before the age of 14. So the problem with the mental illnesses and the lack of treatment is that it creates a tremendous amount of ripple effect through our society. Having a mental illness makes it very challenging, and without a support system, without knowledge, we are not able to manage them correctly. So, You know, mental illness itself costs $193 billion in lost earnings for the United States every year. People with mental illness face an increased risk of having a chronic disease. They die on average 25 years earlier than others, largely due to treatable medical conditions. Over 1/3 of students with a mental health condition, ages 14 to 21 and older, who are served by the special education, they do drop out. They're the highest dropout rate of any disability group. Suicide is the 10th leading cause of death in the United States and the 3rd leading cause of death for people aged 10 to 24. And more than 90% of children who die by suicide have a mental health condition. Nearly 2 million people with mental illnesses are booked into jails each year. And every day, an estimated 18 to 22 veterans die by suicide. So once the person, when I had spoken earlier about people going to jail, once they're in jail, at least 83% of jail inmates with a mental illness do not get access to treatment. And after leaving the jail, a lot of them don't pursue treatment, and they don't have access to the mental health services, and they wind up homeless or in emergency rooms and often rearrested. So there's a large problem with dealing with mental illness, and I'm glad you guys are here tonight so that we can work through this together. So understanding mental illness. So mental illnesses are a medical condition that disrupts a person's thinking, feeling, mood, daily functioning, and ability to relate to others. Mental illness does not develop because of a person's character or their intelligence. Just as diabetes is a disorder to the pancreas, mental illness is a disorder to the brain, and it makes it difficult to cope with the ordinary demands of life. No one is to blame, not the person nor the family. Currently, there are no blood tests or tissue samples that can definitively diagnose a mental illness. Diagnoses are based on clinical observations in the behavior of the person. Symptoms vary from person to person, and each person responds differently to treatment and medication, which really causes a very complicated way to get an accurate diagnosis. The most common mental health conditions include depressive disorder, anxiety disorder, bipolar, schizophrenia, but there are many others. Responsiveness, regardless of the diagnosis, symptoms can be similar. They can overlap, especially in times of crisis. And the following are some examples that you may have noticed in your loved ones. You'll see them on the screen there. It's more important to be aware that the presence of one or more of these symptoms is not evidence that a mental illness is present. This may be a typical reaction to stress, or they may be the result of an underlying medical condition. In fact, one of the most important parts of an initial psychiatric evaluation is a physical workup to rule out any underlying physical illnesses. And this is especially true when symptoms develop rapidly. Often mental illness is not the only thing going on in a person's life. Other conditions may also be present to further complicate the difficulties created by the mental illness. This is referred to as co-occurring or comorbid conditions, or dual diagnosis, meaning there is more than one condition causing the difficulties. Substance use and substance abuse is the most common. Even if a person doesn't have a formal diagnosis of substance abuse, alcohol or drugs can be frequently involved in mental health crises. In addition to complicating the symptoms of mental health issues, alcohol and drugs can also interfere with the medication that they're taking. It's also important that if you have interaction with a police officer, during a crisis, it's important that medication is discussed and if there is drugs or alcohol involved. So there is effective treatment for co-occurring conditions, and once the crisis has resolved, a healthcare provider can make arrangements for referral or appropriate services. So some of the warnings, we talk about a mental health condition. Mental illnesses can be managed successfully through therapy, medication, and lifestyle changes. But sometimes when it does tip the scales and go into a crisis, it does change the person's brain and the way they behave. So, it puts them at risk at hurting themselves or hurting others, and prevents them from being able to care for themselves or function effectively in the community. Many things can lead to a mental health crisis. Some examples of situations that can lead to a crisis could be home or environmental stressors, like changes in a relationship, maybe a death or an estrangement or relocation. conflict or argument with with friends or loved ones, trauma or exposure to violence, also work and school stressors. So worrying about upcoming projects or tasks, feeling singled out by coworkers or peers, feeling lonely, real or perceived discrimination, failing grades or losing a job, other stressors like being in a crowd or a large group of people, experiencing community violence, trauma, natural disasters, terrorism, pending court cases, abusing drugs or alcohol. We talked about that earlier. Starting a new medication or changing a current dosage of a medication could trigger a mental health crisis. When your treatment stops working, or missing doses or stopping medication altogether. So these are the warning signs of a mental health crisis. Those are things that it's important to be aware of how long the changes in the personality or the daily functioning have been occurring and how much difficulty they are causing. So what to do when a loved one is in a mental health crisis or you're worried about that. You want to make sure that the person is not in danger of hurting themselves or others or property. Having the time to call for professional guidance. You can call 988, but there's also helplines. If it's not a suicide or a life-threatening emergency, there are other resources to call in order to talk to somebody. And NAMI does have a hotline. It's called a warm line that you can call and talk to a mental health professional about the situation. But like I said, that is not an emergency line. So, and then if you do need emergency assistance, we're going to say this number over and over again, 988, 988. It's like the mental health 911. So that is the key to calling that number when they are in a life-threatening situation. And again, when somebody is in crisis, it's very important to just keep a calm and peaceful demeanor and make sure that we're not overreacting, that we're expressing our support and our concern, we're offering to help, we're not trying to take control, and we're avoiding touching the person unless they've given us permission. We just need to be patient and give them space. So now there are some times where the mental health emergency does advance to being suicidal. And it's a major concern for people with mental health conditions and those who love them. So encouraging someone to get help is a first step towards safety. People who attempt suicide typically feel overwhelming emotional pain. They're frustrated, they're lonely, hopeless, powerless, worthlessness. They feel guilt, shame, rage, or self-hatred. The social isolation is so common in the lives of those with mental illnesses, and that can reinforce this belief that nobody cares about them. So any talk of suicide should be taken seriously, and many people who attempt suicide have given warning signs, but this isn't always the case. If someone has attempted suicide before, the risk is even greater. So common warning signs, as you'll see on the screen, giving away personal possessions, talking as if they're saying goodbye, taking steps to tie up loose ends, like organizing personal papers or picking up or paying off debt, making or changing a will, collecting and saving pills or buying a weapon, saying things like nothing matters anymore or you'll be better off without me, withdrawing from friends, family, and normal activities, and also increasing the drug or alcohol use. So what do you do when someone is suspecting suicide? Don't be afraid to have that conversation with them. You can open the conversation by saying something like, hey, I've noticed lately that you haven't been sleeping, or you aren't as interested in soccer anymore, or you're posting a lot of sad songs. You can say something like, are you thinking about suicide? Or do you have a plan? Or have you thought about how you would do it? Or when was the last time you thought about suicide? If the answer is yes to any of these questions, they might be at an immediate risk of suicide, and you need to seek help immediately. So the first thing you want to do is you don't leave them alone. You want to call their therapist if they have one, or another healthcare professional, and you want to remove potential means such as weapons or medication. There's the National Suicide Prevention Line that's listed there too, or 911, which now we have 988. So if the situation is life-threatening, calling 988 and ask for someone on the mental health team to respond is a crisis intervention team. CIT officer is what you're going to request. And there's a few things that we want to focus on. We want to listen to them. We want to express concern. We want to reassure and focus on being understanding and caring and non-judgmental and saying things like, you're not alone. I'm here for you. Or I may not be able to understand exactly how I feel, but I care about you and I want to help. Or I'm concerned about you. I want you to know there's help available and to get you through this. Or you're important to me and we can do this together. Now, things you don't want to do are promising secrecy. Like, I care about you too much to keep this kind of secret. You need help and I'm here to help you get it. Or don't debate the value of living or argue that suicide is right or wrong. Don't answer in a way that indicates you want no for an answer. Like, you're not thinking about suicide, are you? Where their instant answer is a no. Or you haven't been trying to throw up, trying to lose weight, have you? Don't try to handle the situation alone. And don't try to single-handedly resolve the situation. Another thing that is not great to say is we all go through tough times like this. You're going to be fine. Or it's all in your head. You need to snap out of it. So please remember, a suicide threat or an attempt to a medical emergency requiring professional help. So you need to get help as soon as possible. All right. So what do we do when there is a mental health crisis? As you can see, there is a number of things that we have to be mindful of because their behavior, if somebody is in a mental health crisis, a lot of times their behavior can be unpredictable and can change drastically. So I know this is a lot of information on the screen, but do not worry, all of it will be provided to you. So, but it's definitely a goal to de-escalate. And if you don't feel safe at any time, you can leave the location immediately. So when you do call for help, it's good to be very clear on what is happening. So for example, if you call and you say, my sister is behaving strangely, that is a little too vague. What might be more helpful for the people at the other end of the 988 line is my sister hasn't slept in 3 days. She hasn't eaten anything in 5 days, and she believes that someone is talking to her through the television. So those are really solid ways to communicate to the officers how important it is and really what's going on in the mind of that person. So let me back up real quick. So the nice thing, Jen is going to, when she takes over, she is going to be sharing more about what happens when you call 988, and she will help walk through more details on this. So if you do have any questions in regards to that process of what happens when they come to your house, she's going to get into it in much better detail. So I'm going to leave that to her, but we're going to move on to what happens when your loved one is put into a mental health facility. And there are a few different things what to understand in regards to mental health treatment. And treatment decisions, the goal is that they're made in collaboration with the treatment team and the family member in crisis, but that's not always the case. Voluntary admission is always preferable. The immediate outlook is brighter for the person who understands the necessity and the benefit of hospitalization, and they're willing to participate in the treatment plan. So the voluntary admission is when the person agrees to go to the hospital and be treated. Tricky part is private insurance covers only a short hospitalization, and a lot of times it takes a lot of work in order to get a full hospital stay so that they can meet all their criteria for their treatment. But knowing what your insurance will cover before you have a crisis can also help things go smoothly. And I know from personal experience working in, when I had a family member go into a psychiatric unit, the hospital was incredibly helpful. So when we took this person to the emergency room, the hospital social worker worked with my insurance really closely to make sure that everything was covered as much as we needed so that my family member was safe. All right. The next one is called an involuntary admission, and this is a commitment. This may be recommended for someone who's experiencing extreme symptoms such as psychosis, being violent or suicidal, or refusing to the healthcare professional's recommendation. If law enforcement and or a mental health professional became involved, you may have no choice. So getting a court order for an involuntary hospitalization of an adult with a mental illness is complex, and it varies from state to state. So I say that now, there's a lot of things we're going to be talking about in the next few things that it really depends on what state you're in. So in Kansas, there's many different laws than even just across the border in Missouri. So there are a lot of things that do apply and don't apply. So I'm not going to get into the real technical stuff because it really does depend on what state you live in. So just so you know. But getting a court order for involuntary hospitalization of an adult with mental illness, it is complex and it varies. So it's designed to balance the need to provide treatment in the least restrictive environment with protection of the civil liberties of the person who's in crisis. And that's a really tough balance sometimes when that person is so ill. So when family members see that rapid deterioration of a loved one, their instinct to protect them is so strong. And they're terrified that they may get hurt or injure someone else or even die. But balancing the urgent need for treatment with the person's basic civil rights can be controversial and very difficult. I've talked to many people who live in very different states and the laws are very different. So seeking involuntary hospitalization of a family member without having it damage family relationships or the self-esteem of the person is incredibly challenging. So there are specific laws in each state that define the criteria for involuntary commitment to a psychiatric facility. And this is a legal process that involves a judge and a hearing. And typically the criteria does include the following: recent threats or attempts to physically harm themselves or others, a recent inability to care for themselves for food, clothing, shelter, medical care due to their mental illness symptoms, and a recent risk of harm to themselves or others. So emergency holds are the next option, and this is an option for crisis situations and can be ordered by a physician and in some states by law enforcement officers for a temporarily confinement of a person in a secure facility such as a hospital. Emergency holds typically last for 72 hours, and they're not including weekends or holidays. The purpose of this hold is to keep the person safe while determining the next steps. It doesn't necessarily initiate the involuntary commitment process. It's a way to further assess the person while keeping them in a safe environment. So, and the last type of mental health treatment, crisis treatment, is an inpatient psychiatric unit. They're more intense, more like an intensive care unit. They can be noisy, they can appear a little hectic. Unlike other areas of the hospital, these patients are usually not in their rooms. They're out and about. They may be talking loudly or expressing very intense emotions. Being hospitalized for a mental illness is also different because of the restrictions in place to protect the person who's receiving treatment. These can include locked doors, restrictions on clothing and gifts, restricted visiting hours, limits on where the patients can and cannot go. Phones are located in common areas and they're not to be used, like there's a lot of restrictions around the phone. So these rules are in place to really make sure that the patient is safe and the others are safe, but due to privacy laws and treatment schedules, the visiting hours are usually very limited. And when you want to get in touch with them, you have to call the main number, and sometimes you get them and sometimes you don't. But being polite and assertive is probably the best use or the best way to get a message to your loved one if they are in an inpatient psychiatric unit. So during the hospital stay, it's very important that your loved one is still in contact with people from their community to provide reassurance and support. So encourage your loved one to call those friends and family members of your loved ones, get visits from friends and neighbors and advocates, specific family members, and even spiritual leaders is very important while they're there to let them know that they are loved and that they're loved. Yeah. A couple key things for you to know: that even if your loved one does not sign you in as their person that they can share information with on their HIPAA agreement, you can still talk to their providers. So you can give their providers information about your family member, even if they have not consented for the hospital to share with you. And that's super helpful because then you can kind of help fill in the gaps, and they may not say anything back, but they will thank you for their input because I know it is very valuable for them to help fill in the pieces of that diagnosis and treatment plan. Also, if a release of information has been signed by your loved one, the family member should attend the treatment team meetings. That's very important. And yeah, so very important. All right, let's talk about the types of treatment that are had in a mental health crisis or in a mental illness. These types of treatments are both an inpatient and outpatient. And so outpatient mental health services are provided when the person lives at home and they continue their regular routines with work, school, family life. For this reason, outpatient services are considered the least restrictive form of treatment. But inpatient means that the person is admitted, and that's what we just discussed a minute ago, requiring them to stay overnight in the hospital. So these professionals are available both inpatient and outpatient. So certain forms of psychotherapy, which is often called talk therapy, and social and vocational training are helpful in providing support, education, and guidance for people with mental illness and their families. So individual psychotherapy usually is scheduled sessions between a person and a mental health professional. This will include cognitive behavioral therapy, CBT, or dialectical behavioral therapy, interpersonal therapy. This is individualized psychotherapy. There's also psychoeducation, which involves teaching people about their mental illness and the treatment options. And then self-help and peer support groups. And these are for people and families led by people with personal experience. These groups are comforting because the participants learn that others have experiences like theirs and that they're not alone. So a perfect example of this is our NAMI Connection group. And this is a group led by peers who live with mental illness. And it's not therapy, so it is not meant to fill that void, but it is meant to find comfort and support and encouragement with others who are living with similar conditions. We also have the NAMI Family Support Group. This is a great way to get support, resources, and like I said, encouragement, and just knowing people who are going through similar things that we are as family members is really important. The next one is a peer recovery education, and this is a structured instruction taught by people who have lived experience, and this can take place in a single session or a class over time. And NAMI's peer-to-peer program is exactly that. It is a peer recovery education. And then peer run services. So these are mental health programs where the staff uses information, skills, and resources that they've gained in their own personal recovery to help others. So the peer services are really run on principles of empowerment, choice, mutual help, and recovery. The goal of peer run programs is to create a supportive place where people can find peers that understand them, they can learn recovery skills, and help others. So we have one clubhouse, which is a peer run service, and it's called Reclamation Clubhouse. It is in Olathe, and that is a peer run service that fills that type of treatment. And then also certified peer support specialists. These are people that work alongside healthcare professionals in a traditional mental health program to provide extra levels of support to people with mental illness. So, all right, medications. When a person is starting to stabilize and gain more control and having a clear perspective and more stable emotions, medications do help with that. Any licensed physician can prescribe medication. Psychiatrists and psychiatric nurses, psychiatric nurse practitioners are the most knowledgeable about psychotropic medications. And these are the questions that you have right here are the number of questions that you want to make sure that you ask when your loved one is put on a medication. And, psychiatric medication does have some bigger side effects. And sometimes it takes a long time for it to actually start working to its fullest function. And so it's important to take notes about what's your loved one is experiencing, if the symptoms are, if they're disappearing or if they're still there or worsening. So keeping a close eye on medications is a very wise thing to do. So we're going to talk about the different types of healthcare professionals that are involved in mental health treatment. So your psychiatrist is a medical doctor who specializes in psychiatry, and they're usually the ones that are in charge of the patient's care plan. A psychologist is going to administer the diagnostic tests and conduct individual, family, or group therapy sessions. The psychiatric nurse practitioner, he or she is going to diagnose and treat mental health conditions and provide healthcare, including prescribing medication. Physician's assistants, they treat illnesses, including prescribing medication. Registered nurses, RNs, they assess the patient's progress, provide emotional support and encouragement, and health education. The RN also administers medication and monitors the overall health of the patient. A therapist conducts individual, group, or family therapy. They can be a psychologist, a licensed clinical social worker, a licensed professional counselor, or a marriage and family therapist. Social workers, their job is to identify social services and therapeutic needs and help connect the patient with the community resources and make those referrals for service. A nursing assistant or a psychiatric aide, mental health worker, behavior technician, they all work under the direction of the psychiatrist, psychologists, nurses, and social workers in an inpatient setting. Their job is just personal care for the patient, including eating, dressing, grooming, whatever they would need. And then case managers. These are the ones that are going to be assisting with applying for resources such as Social Security benefits and Medicaid. They're also aware of housing options and in their area, and they know how to get housing vouchers and rental assistance. They know about community programs and groups, and also job training and how to get work. And then there's patient advocates. These assist families to resolve or address issues regarding quality, appropriateness, and coordination of care. So, and then occupational therapists. They assess the patient's ability to function independently. Their assessment areas include the patient's strengths and behaviors, social skills, and cognitive skills. They help through the daily living and the functional ability with their work skills, their goals, and their sensory needs. They also help perform evaluations. So there's many people that are involved in the treatment of our loved ones with mental health conditions. So now we're going to talk about what happens when you get out of the hospital. And now you're discharged. The discharge plan includes ways you can help care and support for your loved one once they are released from a hospital or an inpatient setting. Discharge plans are not always shared with family members, but don't hesitate to ask what the plan is from your loved one once they're released. So, advocating for treatment. Your loved one deserves the effective and appropriate care for their mental health, and it can be difficult to find the right services. However, being an advocate, the person that supports them, the time it would take to spend finding the services and helping them out is an important role to play. There are 3 types of advocacy that you can do. There's personal advocacy, public advocacy, and legislative advocacy, obviously with rights and bills and government, and then also with being connected to the community and sharing your story. And then who to contact with grievances. So if there are concerns about the care provided or other aspects of the treatment service, it's important to bring that attention to the staff, the direct care staff. If that person is not available or the issue is not resolved, they need to speak with the facility director or the administrator or nurse manager. If the problem is not resolved, you may want to contact the patient advocate for the organizations. There's a number of other disability rights offices that you can contact as well if there are grievances that are not resolved by the hospital directly. All right, so just a few more slides. Other types of crises that can occur with mental health crises is searching for a missing loved one. If your loved one is deemed missing, that is a very traumatic and scary time. And there's a number of things we can do to help find them. And that's, registering them with the National Missing and Unidentified Persons System, uploading their info on findthemissing.org, check nearby hospitals, religious centers, homeless shelters, and libraries, utilize social media, create websites, alert the local media, contact your NAMI affiliate. We do get calls about missing people to see if they've been in our system somehow, taken a class or called or something. And then there's also an initiative with the Johnson County Sheriff's Office for people with physical disabilities. So it's called Bring Them Home. And this does count for people with autism. So a lot of times people with autism will have a mental health condition as well. But Bring Them Home is an initiative with the Johnson County Sheriff's Office that you can pre-register your loved one. And that way the Sheriff's Office understands that in your home, you have a person with a physical disability, autism, dementia, Alzheimer's, and they understand that the care or the ability to get that person's attention and get their cooperation if there were a police incident is going to be different. So it's a great way to kind of get ahead of any conflicts with the police is having your person registered with Bring Them Home. But Bring Them Home only qualifies for physical disability. So they do count autism and dementia and Alzheimer's within that. But sometimes those are paired with mental illness. So that's why I bring that to you. All right, when a loved one is arrested, you really want to make sure that you're communicating any medication needs to the jail staff. You want to make sure you share their diagnosis and share their medications and the need for that. You also, there are many advocates that help in regards to mistreatment in jail, and those are all listed in the manual that you will receive by email. Also, going to court. If the arrest of a family member may mean they need to appear in court, knowing what to expect really helps. So you will be working most likely with a public defender. Most people charged with crimes are assigned a public defender if they can't afford a private attorney, and the public defender works for your family member, not you. You can ask your loved one to sign a release that allows the attorney to share that information with you, but it is not guaranteed. So, and then of course, if you need help finding an attorney, NAMI's helpline does have a legal resource, so you are welcome to call them. And then when it does come to preparing for that court experience, there's a number of things to do that can kind of de-escalate and make sure our loved one that does have a mental health concern is a little more subtle, because it can be a very traumatic experience to be in court as well. So, all right. So like I mentioned before, preparing for the future is very important with our loved ones who experience a mental health emergency. And one of the files that you'll be receiving is actually going to include all 4 of these. So, or actually the first 3. So it's a portable treatment record. We're going to, there's a medical history and a current info, and then a crisis plan with a relapse plan. So knowing a few peers who have a few people in my life who have been hospitalized multiple times, this crisis plan and relapse plan is valuable, because they know some of the symptoms that they have that are going on, so that they can share those, so that their loved ones can know and get ahead of the crisis and help de-escalate it, so they're not going to jail again or being hospitalized again. So, and then of course, connecting with your local NAMI affiliate. So what we do is we educate, we support, we advocate, and by our support groups and our classes, we build a community of people that understand and support, and we'll try to resource you if you are in a crisis. So at this time, I'm going to pass it off to Jen and let her talk to you about the police involvement with what happens when you call 988.
Okay, let me make sure I have my right slides on here too. Okay, I'm gonna share my screen. Kelly, you'll have to let me know if I'm good to go. Look good? Okay.
I see it. Looks great.
Okay, so I'm going to talk about crisis services in terms of what we have in Johnson County. For starters, in terms of what counts as a crisis for us, and what I'm referring to us, I'm referring to our crisis line, which is also 988, co-responders, and CIT. And so we really respond to any type of crisis. So crisis is relative to whoever is experiencing it, right? And because of that, we also have a spectrum of different resources that are available depending on the acuity of the crisis or the safety concerns. And so I'll talk about that today. But behavioral health crisis, intellectual disabilities, Kelly talked about autism, the intellectual, the IDD population will respond to assist with those kinds of crises. Traumatic brain injuries, a lot of aging and dementia calls, homelessness, substance abuse, really anything that police come into contact with. They're going to be similar things that co-responders in the crisis line are helping assist with, either by phone or in person. So like I mentioned, what I'm going to talk about today, crisis line, co-responders, and CIT. To start with crisis line, so our Johnson County Mental Health Crisis Line is local. It is stationed. We were out of mission for a really long time, and now we are in Olathe with dispatch, with medical dispatch, ECC. And so our local line is the 913-268-0156. We also answer for 988. So we right now, like 911 is geolocating. So that means if I call 911 and I'm in Lenexa right now, I'm going to go directly to Lenexa's dispatch. However, 988 is not geolocating yet. So if it's based off of area code. So if I have a 913 area code, then I will be sent to the local Johnson County crisis line. But if I had my phone in Texas and then now I live in Kansas, I'm not going to get local mental health professionals if I call 988. So that's why we really still push out the 2680156. I think 988 is going to be geolocating hopefully in the next year or so, but for those reasons, that's why we still push out our local line. It's 24/7. Answered by mental health professionals. There are always clinicians available. There's also bachelor's level staff that are answering those phones, and they can consult with a clinician if needed. We're going to do crisis assessments, referrals. So Kelly mentioned earlier of like a warm line or a crisis line or a hotline and what the differences are with those. For Johnson County purposes, we don't have a difference. We have people call because they're actively suicidal and they want to talk to a mental health professional. We have neighbors call who say, I talked to my neighbor the other day and she seems off. She seems sad. Can somebody check on her? So we get referrals. We get referrals from other like doctor's offices even. They'll call and say, we did our questions that we ask in the office and they indicated that they were having some suicidal thoughts. And so can you talk to them before we let them leave? So really anything that you can imagine, we get calls for that. Preparation, we'll have parents call and say, my kid's getting ready to come home and I had to have this conversation with them. I just want to walk through what the conversation is going to look like before I have it because I don't want to say something that's going to cause a mental health crisis. And we can talk to you about stuff like that too. So it doesn't have to be an active crisis. It can be anything that has to do with crisis, mental health, resources, anything. So anybody can call at any time. Let's see. Co-responders. So co-responders are Johnson County mental health clinicians. We're in the police departments and the sheriff's office in Johnson County. Currently our team is made up of 2 different team leaders. So I'm one of them. And then we also have one other team leader. And we have 21 co-responder positions now. So our main focus is going to be 911 response. And so, previously we talked about, calling 988 to request CIT. At least in Johnson County, that's not possible yet. So if you want CIT or co-responders, you have to call 911. If you aren't sure if you need police yet, and you're not sure if you need a co-responder, because co-responders will only ever come with police officers. They don't go by themselves. You can call 988, tell them what's going on, and they might tell you, you need to hang up and call 911. So if you're not sure, you can always start with 988 and they will recommend that you call 911 or they will call 911 for you. And so that's the other thing is that if you do call 988 and there is a safety concern and 988 is not able to help you de-escalate the situation or your loved one de-escalate the situation, even there are going to be times that even if you don't want police to come, they might have to initiate police coming based on how the call ends. If it ends abruptly or they can't get a hold of you, or if you're not able to contract for safety, if they're unsure, they're likely going to call in a welfare check to check on you or your loved one. So like I said, co-responders, our main response is to come out with police if there's an active 911 call that is mental health related. And so that happens a lot of different ways. So that can either come out as like an obvious mental health call where a loved one or someone calls in and they say that they're suicidal or they say that their loved one is in crisis and they need assistance. Or it can come out as, maybe a suspicious person or a medical call or, it could come out lots of different ways. And then once the officers get out there, they realize that there's probably a mental health component and then they request a co-responder to come out. We also do follow-up. So if we're on the call, we follow up with those folks afterwards to make sure they're connected to resources. If we're not on the call, then every single police report in the county has to be marked either yes or no for mental health. So if it's a traffic stop, if it's a theft, if it's any type of criminal call you can imagine, every single report has to be marked mental health yes or mental health no, before it can be approved. So before the officer can submit that report, if it's marked yes, it gets sent to co-responders to review it. And so then we'll follow up with those folks too. So it could be a traffic stop where somebody's having a really hard day and they disclose to an officer that they have some mental health concerns and they're not doing well. Even though they get a traffic ticket, that officer could still refer that person to the co-responders and say, hey, can you just follow up with this person and check on them? Our sheriff's co-responders also are involved with eviction. So if someone is being evicted, they can notify, if they have a treatment team, they can notify their treatment team. If not, they could do some of that proactive outreach to see what their plan is, give them some resources. We also do trainings for the community and for officers. My next slide is our map. So like I said, we currently have 21 co-responder positions. This is kind of the breakdown. If you scan that QR code, we have a Johnson County co-responder map that looks like this, but where the QR code is all of the co-responders' email and phone numbers. So this stays updated if we have staff changes. But we have 21 co-responders. They're all part of the co-responder county team, but they're assigned to specific police departments. So you'll see that like Overland Park has 6 and Olathe has 4. Those are our 2 biggest programs. Those have our CIT units. We call it Behavioral Health Patrol, essentially, that they have officers within the agency who have signed up to be a part of the co-responder unit. And so those co-responders are partnered with an officer, and they kind of do behavioral health patrol where they're riding in the car, kind of jumping those mental health calls for service so that the other officers can stay in service to handle other calls. Same with follow-ups, they're kind of partnered up. The rest of the programs, which is what I supervise, we have our self-dispatching co-responders. So we have our Johnson County cars, and we just work with whatever officer is working in that district that the mental health call happens in. And so we'll come meet the officer out where they are and take over and work with the clients in the community.
Jen, this is Vicky. Can I just, there's a question in the chat, and
yeah.
I want to catch it before, because basically it's about numbers. How many Johnson County police officers are CIT, and are the co-responders working 24/7 with the police?
Okay, yeah, I see the question now. We do not have 24/7 co-responders. However, if it's pretty much standard policy across the county that if a co-responder is not available, then the officer actually calls the crisis line to consult with the crisis line staff. So if a co-responder is not available, the officer will call the crisis line, and that crisis line staff will try to do a similar assessment that what a co-responder would do in the field by phone. For CIT train, I'm going to get to CIT in a second, but countywide, I think average is about 60% trained, which is well above the national average. So Johnson County is really ahead of the curve on the CIT training. I'll actually just go to that slide next about what CIT is. And so CIT is used interchangeably a lot. CIT actually stands for Crisis Intervention Team. A lot of times people only think about the training aspect, but it's a lot more than training. And so CIT is actually a model of community policing that brings together, it's like a partnership of law enforcement, mental health providers, hospital emergency departments. And so we have the Kansas CIT Council that is made up of mental health providers, officers, advocates, and so they meet, and they're really, the goals of CIT is de-escalation, figuring out what the best way to provide de-escalation to the community is, if that is police, if that's mobile crisis, if that's 988, diversion, so keeping folks with mental health concerns out of jail and out of the hospitals if they don't need to be in the hospitals. Like I said, partnerships, and then training. And so the training that is provided by CIT is a 40-hour training, and it's available to any officer. So we talk about like CIT units and requesting CIT when you call 911. But any, like I gave the example of a traffic officer before, you could have a specialized CIT unit that rides with a co-responder that has been to 40-hour training. You could also have a traffic officer that doesn't go to any calls other than just pulling people over, and they've had the same exact training as the people who are designated to be mental health police officers. And so I say that just because I don't want people to get so hung up on that it has to be a CIT officer or a CIT unit, because a lot of times officers who maybe aren't as interested in mental health enough to do it all the time, as that's their only role, have had the same training and are just as good or maybe even better than some of those officers, just based on their experience of working with folks that have mental health concerns. I'm not going to read through all of these, but this is kind of the agenda of the 40-hour training that the officers go through. So they cover lots of topics, and it's really just to kind of prepare them for all of the different things that they might see on calls, because officers really are going to be that first line of folks that are responding to any kind of mental health crisis if you call 911. I can't remember, Kelly, if you mentioned something made me think of, police are always going to be dispatched to a mental health call. So if you call requesting medical personnel, police are always going to be dispatched to any kind of behavioral health crisis. And that really is just because of a lot of factors. We're going to talk about, Kelly already kind of talked about what to say when you call 911 and how to stay calm. In reality, a lot of folks are not able to do that. They're not able to stay calm when they call. And so the dispatchers are not able to tell medical personnel exactly what they're walking into. And so medical personnel request police for their own safety. And so anytime there's a behavioral health component, police are always going to respond first and make sure that the scene is safe for medical personnel or co-responders. And that's going to be a secondary response for the medical or the mental health clinicians. That doesn't mean that they're going to stay the whole time. They might be able to decide that it's safe and it's just medical if a co-responder is not there, and they can clear, and medical can take over. But they will always be dispatched, at least in Johnson County. That is the protocol as of right now. Like I said, we have these handouts. Every agency in the county has access to these handouts that are kind of a 911 checklist that we give to family members who think that they might need to call 911 when they have someone in crisis. We tell them to keep it on their fridge. It's a little bit blurry, but these are some of the things similar to a slide that Kelly had earlier, but basically what dispatchers are going to ask you for. And so kind of having something like this ready, because like I said, people have a hard time staying calm when they get to the point where they realize that they need to call 911. And so you could have something like this that's already filled out on the fridge and that you're basically just reading to the dispatcher when you're calling in. And then also has kind of like what to expect. It really is going to depend on what information dispatch either has or doesn't have. And so a lot of times, if there's any mention of like a weapon or anything like that, the police response is going to be in accordance to that. So like meeting the level of safety that they need to have. So that's why it's really important that you give more information than not, so that they can respond accordingly. That's all I had specifically, but I'm happy to answer any questions. I'm gonna stop sharing though.
Thank you, Jen. That was helpful. Are there any questions? Vicky in the chat. Yeah, go ahead, Vicky.
Yeah, I was just going to say, Jen, I appreciate it. And I really do like that whole communication that was your last slide, to put by the refrigerator or your telephone, somewhere where you can access it. The refrigerator is usually a good place to have something like that. Because I think it is hard to stay calm, right? Whenever we get in those situations. So if you can have that list of what they particularly would want to know, that I think it's a great idea.
Yeah. And
I listen and talk to cops and dispatchers every day, and the one time I've had to call dispatch, I'm still like, oh, I don't know what I'm supposed to tell them. So it's hard.
All right, Jennifer, you've got a question.
Hi. Yeah, my name is Jennifer, and I do our virtual family support group. I facilitate that, as well as I'm one of our family to family instructors, and have used Overland Park Police. And one thing I have suggested to add to that sheet, and I don't know who it is, but it would be something, not only a trigger, but something that calms your loved one down.
Mhm.
As a caregiver, like you said, it's very hard, even if you're really trained, to stay calm. And if you could think of a pet or even something a fidget or something that calms them down, that helps a lot. And I would just see if we can add that to that list as a possible. But thank you for coming tonight. I got educated. I wasn't sure. I was not aware that 988 didn't ping. So that is good to know as we give out that information. And people have cell phones, like you said, that have moved here. So I appreciate that. And thank you for your time a lot and your dedicated service to the mental health community.
No problem. Thank you. Thanks for the recommendation. I can get that to the right people about the something that helps calm coping skills.
Go ahead, Linda.
Can you hear me?
Yeah.
I had to switch from my computer to my iPad. How would you find 988 access or equivalent of that if your loved one was in another state and you had been communicating with them and learned that they were in crisis? Other than, I don't even know how you would begin to contact that kind of service.
Yeah, so if there's no like immediate safety concerns that you don't think that you would need to call police for wherever they are, you could call 988, and I know that there is the option to transfer to other 988 centers.
Oh, they do have a transfer?
They do have that. I think you just have to have pretty specific location information to provide to them, and then they could probably transfer to the nearest 988. But if there was concerns about needing to physically check on them in person, I would just err on the side of looking up that dispatch and wherever they live.
Okay, thank you.
Any more questions?
This was really helpful. Thank you both,
Okay.
Kelly and Jen. You know, we think sometimes as mental health advocates and being involved with NAMI that we have a pretty good drill on this, but there were a number of things that I picked up on from your presentation this evening that were helpful. So thank you
Awesome.
very much.
Awesome.
I want to
Well-
thank everybody for attending. Can I just remind people that I've put in the link for the evaluation? And if you would do that, if you'd spend a little bit of time and complete that, that would be great. And then also, if you do want a certificate of attendance, also do it to our Gmail, which I also put in the chat. And just an FYI, that evaluation is anonymous, so nobody knows who it is, who's completing that. But we really appreciate your time. And Jen and Kelly, thank you, because it was very helpful. You always pick up things that you go, oh, would that be helpful? And it's better to do it proactively than when you're in the midst of the crisis, right? So
Yes.
we do. Thank you very much.
You're welcome.